Welcome everyone. Welcome to our YouTube channel. I'm Cevdet Acarsoy. I'm a PhD candidate at Erasmus Medical Center, Department of Epidemiology, and I'm also the co-founder of Gelecek Bilim'de, which is Future is Science in Turkish. We are an online science communication platform with over 40 plus volunteers. We have blog posts, articles, YouTube channel, Twitch channel, and social media accounts. You can find us with the name of Gelecek Bilim'de. And in this episode, we will do the 2-minute challenge. We were doing it in Turkish and it was a great hit. And we wanted to start it also in doing it internationally in English. And this format is, as the name suggests, 2-minute challenge. It's a challenge for scientists and experts to explain the terms, the plain terms, the concepts for the beginners, for absolute beginners. And the rules are really simple. We will ask our expert 10 questions. 7 of those questions will come from the questions that we prepared together and the most frequently asked questions. And 3 of the questions are coming from the Google autocomplete. And for each of the questions, our expert will have 2 minutes to answer. You will see a countdown. And after the countdown ends, he or she has to stop. And while explaining these 10 questions for total, our expert will have 3 term jokers, let's say. That means he or she can use maximum of 3 complex medical or scientific terms, and when she uses, she needs to explain what they means, and we will take account of those. Okay, and today's topic is migraine, which is also one of my research areas, and for this we have one of the world-renowned experts. I'm so excited to have her here, and Professor Maassen Van Den Brink. I will introduce her to you really quickly. And she's a professor of neurovascular pharmacology at the Department of Internal Medicine, Erasmus Medical Center. She studied biomedical sciences in Leiden, and later on she obtained her PhD at the Department of Pharmacology at Erasmus MC. And her field of expertise is neurovascular pharmacology, with special interest in the role of female sex hormones and pathophysiology and cardiovascular risk of migraine. And she's also teaching at the different levels of medical school and epidemiology school. And she has over 170 scientific articles, and she's also a board member for the European Headache Federation. So I'm so excited to have her here. Without further ado, let's invite her to the stage. Antoinette, welcome.
Hi, Cevdet. Nice to see you.
Nice to see you too. Thank you for accepting our invitation and being here.
It's a pleasure. It's something else than I'm used to do, so it's exciting, and we'll see.
Yeah, let's see. And I think you are courageous to accept this challenge, because it's really a challenge for the scientist, but it will be fun to watch for every user.
Maybe I will regret it afterwards, and it will be even more fun for the ones listening and looking, but we will see.
Yeah, we will see. I think you will one of the persons that I trust that would like this and would be able to do this.
Okay,
and
you
explain.
Are increasing the pressure now. Eh?
Okay, so okay, I'll stop. Okay, I'll stop. So let's start with the first question, and
Good.
for the audience, they see how it goes. Let me bring the counter. Okay, so the counter is here. Okay, so the first question is, what is migraine, and what is the difference between migraine and other headaches, let's say?
Okay. Migraine is a condition in which persons have quite some symptoms, and headache is one of the symptoms that migraine patients experience. And in fact, there is even a form of migraine where you have migraine and the other symptoms, but not the headache. But that is really an exception. And headache is the most prominent symptom of a migraine attack. But migraine consists of more. So in fact, there's a phase in which the body is getting the attack slowly. And sometimes the patient even doesn't notice that an attack is coming, but he or she starts craving for certain foods or can't handle stress very well. And then in some patients, there may be additional symptoms that are called aura. And then they see flickering lights or other things happen, or even they have a strange feeling on their skin. And then in the majority of patients, the headache starts. But it's not just headache. Patients also get nauseous or they are vomiting. And often they can't handle light or loud sounds. So they like to retreat in a dark room and be quiet and silent there. And then after a while, they get better, but they may still feel a little bit like they have a hangover. So a migraine attack is really something which, there happens a lot. And headache is one of the most bothersome symptoms of a migraine attack.
Okay, thank you. And right on time for the first question. How do you feel? How did it go?
It was okay.
Perfect. So, without stopping, let's continue with the second question, shall we?
Yeah.
And the second question is: are there subtypes of migraine? And because it has, as you explained, it is more than a headache. It has
Yeah.
different symptoms. Are there subtypes of it?
Yes, there are definitely subtypes of it. I was already telling that patients may have these symptoms often just before the headache starts, 20 to 60 minutes before. And these flickering lights or sensations, or sometimes even they cannot find certain words, that is called aura. So we can distinguish migraine between migraine with and without aura. I think these are the most prominent forms, but there are more forms. There are even forms that are genetically well defined. We really know that patients have a certain mutation, a change in their genetic material. And in these subforms, patients even during the attack cannot move half of their body or parts of their body on one half of the body. So that is a subtype. You can also discriminate between migraines that get so frequent that in fact there's a chronic form. This is called chronic migraine, in contrast to the other migraines that come in episodes. And some migraines are really related to the menstruation, but then we can call it menstrual-related migraine, but that is often migraine without aura. So there are certain groups that do not exclude each other. But I think if you want to have the main division, then you can say you have migraine with aura and migraine without aura. And these are the main groups.
Yes, thank you. There are quite a lot of groups information, but I don't think you used any medical or scientific terms
I think
while telling
no.
those. So good job
Yeah.
so far. But you can use. You have three options in the future.
Yeah.
So I think that's a difficult question, but the next question. But I don't think anyone better than you to know the current state of our scientific information about this.
Mm-hmm.
Why does it occur? Why does it happen? Why do people have something like migraine?
Yeah. This is a very difficult question. And the short answer is I don't know. And I think nobody knows. But when thinking about it, it's interesting because if you look in evolution, then often certain traits that are harmful for people would disappear from humanity. And if you look at migraine, it's quite stable and it was not gone out of humanity. And why is that? You could say several things. First of all, women with migraine tend to feel better when they are pregnant. So maybe migraine women want to get lots of children, although later on it may be a burden in their life. But a more serious explanation may be that maybe a migraine attack is a way of the brain to protect itself. Because in fact, a migraine patient during an attack is really forced to stay quiet. I already told to go into a dark, quiet room, so the brain has less input. So it's only speculation, and we really don't know. And maybe there is not really a why. It is a disorder that people want to get rid of, but it seems to be a reaction of the brain to certain circumstances when a threshold is crossed. So maybe it's a reaction of the brain to get a time out and force the owner of the brain to take a break.
Yes, very interesting hypothesis about it. I remember something like something similar for depression also. So maybe subtle forms, not like the severe forms. It is actually nice. It's like getting sick and resting and getting better. It just brought my mind that explanation.
Yeah,
so that's
I
why
think
maybe
patients won't agree that it's nice, but often in evolution there's a certain reason for disorders. So who knows?
But it's not nice, but maybe that's the function, right?
Yeah.
So let's continue with the fourth question. And what are the triggers of migraine? Because I think there are some myths about the triggers, or some people say they triggered by something, and there are lots of information on the websites, on the internet. So let's hear from the expert. What are the triggers that we know of?
Yeah, again, an interesting question. One of the main triggers that I also study in my research is a fluctuation in female hormones. And this happens, for example, around the menstruation. So that is a scientifically proven trigger. However, there are also other triggers that patients report, which were not confirmed yet, or not at all in scientific research. And one of these triggers, for example, is stress, or a period after stress. And patients really report sometimes a relationship. And there's a certain hormone that you can measure. And I think I will use one of my jokers now. It's cortisol. And it's in fact what we can measure that reflects stress, more or less. But if we look at the relationship between cortisol and the start of migraine attacks, you don't find such a relationship. But maybe cortisol is not the right predictor, and we don't know. And similar stories are going, for example, for red wine, for certain cheeses, for chocolate. And several things are possible. For example, for chocolate, it may be, I told in the first answer that there's a phase before the attack, when you are craving for food. Maybe patients eat more chocolate by then, and they get their attack, but it was part of the attack. And women may recognize it before the menstruation. No one will say, I ate too much chocolate, now I start bleeding. So maybe the same is true, and other factors we still need to investigate better.
Yes, perfect. Actually, the one about stress, I was also like reading something about that. I'm not really clear about the details, but it doesn't happen during stress, as you said, but after the stress.
Yeah,
That's so
often in the
interesting.
weekend. So that is one thing. And the other thing in that phase before the migraine attack, now I'm not on the counter, so I can use the term, it's called the prodromal phase. It may be that stress is perceived as more severe. So just before the migraine attack, I may have the feeling that I was subjected to more stress, but maybe that's not the case. But I perceive this as stronger stress because of my different brain functioning. So we really still need to learn a lot.
Yeah. As with the other answers, for the audience to, I think, recognize, in science, there is always other explanations, as you say. Like it could be this way or the other way around, as you said, with the menstruation or chocolate. So just to keep in mind. And then we're approaching the half, and that's, I think, another difficult question. Is there a cure or for migraine, or how is it treated currently?
Yeah. A cure does not exist. And with a cure, I mean something that would really help you to get rid of your migraine forever. One of the cures is getting older, especially for women. They often tend to get better. Not every woman, but most women get better after they have their menopause and they stop menstruating. So, but that has inspired in the past some doctors. They said, okay, if we take the uterus and the ovaries out, maybe it cures these women from their migraines, but it did not. And it's a very big operation that, causes a lot of damage to a woman because she's aging much faster, and it's definitely not a cure. So in that way, we don't have a cure. What we have are drugs to treat a migraine attack, and these can be either normal painkillers, so paracetamol or inflammation inhibitors. Then there are drugs that are designed of terminating a migraine attack, so we call it acute treatment. And these drugs, they are called triptans. I don't think it's a scientific term, by the way, it's just a name. And these were really designed to terminate migraine. And if the attacks are too frequent, or you have you cannot use these triptans for certain reasons, or they don't help, then you can consider drugs that are designed at avoid to get the attack. So you take them in a daily way, or right now, since recently, we have novel antibodies available that are injected once a month.
Yes, and very good. And from the other questions, you have 10 seconds extra for other questions. If you want to go over, you can use 10 seconds extra. And let's see, we are in the fifth question and a half. Let's see where we are. So you answered 5 questions, and you also used 3 terms.
Which one?
Yes, the first one was that you said cortisol that you will use.
Yeah,
and then the last 2 one was the anti-inflammatory, inhibiting the inflammation, that part, and the antibodies. So those monoclonal antibodies. Yeah. And I was thinking not like a scientist but like a general public. I thought that's I don't know what it means.
Now with COVID, we are all experts on antibodies. It's not a scientific term, but I will.
No, not that, but monoclonal antibodies. That part was it. So not the antibody part. Yeah. But I'm picky. I know. Yes. So
I will pay attention.
Okay, so let's continue with the rest of the questions. And we have 2 more that we decided on, and then the last 3 you will select from the Google, so that they will be really what people were curious about. Okay, so the next question is very related to your field of expertise. Why women have more migraine?
Yeah, the straightforward answer is that I really think that it is due to changing levels of their hormones. Because if it would be something that is different between men and women, for example, in their genetic material, then it would be present during the whole life. But if you look, women have 3 times more migraine than men. But it starts after their puberty, this difference between girls and boys. So that's already a sign that hormones are involved. And if you look what happens further, during their menstrual cycle, the incidence of attacks, so the occurrence of attacks is really related to the occurrence of the menstruation. And when these women get pregnant, I already mentioned, often they get a bit better depending on the subtype of migraine that they have, but there's a relationship with the pregnancy. And when they get a bit older and they get their menopause, then often they also get better. So this all really points to changing levels of hormones that are involved. And it's in fact strange if you look at the drugs against migraine that are available now. None of them is directed at these hormones, although women have it twice as much as men. And from these observations, we know that hormones are probably responsible. So it's a bit strange that it has not been investigated very deeply in the past. So we are doing it now. So I hope we will get better treatments for men, but also for women.
Perfect. Yeah, it's really good that you're doing that, actually. So future will be brighter, I think, in that
I
sense.
hope
Let's
so.
see.
And it's
Yeah.
really very invalidating. I don't have migraines myself, but when I speak to migraine patients, I'm really impressed by how much they suffer. And it's, such a pity.
Yeah. 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 So on behalf of the all, I think, public, I can thank you and your colleagues for doing this, and so let's come to the last question before we go to the Google questions.
Yeah.
And does migraine affect other disorders, and what should people with migraine do to stay healthy? I mean, aside from migraine, but its consequences, let's say.
Yes, migraine may affect other disorders, or other disorders may affect migraine. And for example, we know that there is a relationship between migraine and depression, and that really exists. It's not that people with migraine, they suffer so much from their migraines that they get depressed, but it's really scientifically proven that it's a relationship and that goes both directions. And another point that I consider very important, and I know, Jeff, that you consider it important as well, because part of your research is directed at it, is that migraine is not only a burden because of the attacks or the fear for the next attack, but it's also a cardiovascular risk factor. And it's a risk factor of the same order of magnitude as severely elevated blood pressure or elevated lipids in the blood. So it's really something that we should take into account. And the bad thing is that currently we don't know yet how this is caused. We know that migraine patients do have this increased risk for vascular events, but we don't know how it's regulated. And we are doing research to elucidate that. But what can you meanwhile do as a migraine patient? I think the same as is true for all of us, but for migraine patients, maybe try to do it a bit more even. So definitely do not smoke, because smoking is really increasing the risk for a heart attack or a stroke. Try to exercise, that's very important. Try to have a healthy weight. So it's the standard things, and if you know you suffer from migraine, pay extra attention.
Yes, I completely agree. And the depression, so cardiovascular problems like heart attack, stroke, as you said, they are related. Maybe we cannot change migraine, but we can change other factors, right? The exercise or the blood pressure or the lipids,
finally,
right?
I think, we have to understand how this is functioning. And if we understand what happens that causes this increased risk, I think then we can also work on something that mitigates this risk. And I think we will reach that in future. But for the time being, for all of us, it's important to not to smoke, stay healthy, exercise.
Yeah, exactly. And so with that, we reached to the questions that we prepared together. And how are you feeling? How was the
A bit more
experience so far?
relaxed than at the beginning. And yeah, now I have to answer the rest without using any terms because you are so very, very strict to me.
I'm sorry for that. I hope. Yeah, I feel, be strict to a professor about about like a term or something. I feel ashamed to do that.
Oh, no, not at all. It will affect our collaboration, of course.
Yeah, but
No, not at all. It's
for the
fun.
audience, I think that would be much
It's very
appreciated.
important, and it's good that you pay attention to it, that it's just accessible to people also without a specific education. No, I entirely agree with you.
Exactly. Yeah. So let's go to the Google and
Yeah,
let's see what people search
okay.
for.
This
How
is
Google,
interesting.
yeah,
Yeah,
how Google autocomplete it, and
yeah.
one of the autocompletes you can choose to answer, and it will be
Yeah,
the next
let's have a
question.
look through it. Oh, this is a nice one. Why migraine before periods?
Okay, so that's the question, and the time started.
Yeah, so with period, of course, the menstruation is meant. And why does an attack happen just before the period or, yeah, just at the start of the period? Well, again, the short answer is we don't know yet, but of course we do have ideas. And if you look at hormones that are specifically they are not specifically for women, because men also have these called female hormones. But if you look at the hormones that are mostly present in women, then they fluctuate throughout the menstrual cycle. That is about 4 weeks. And if you look at the start of the menstruation, these levels were a bit higher and they tend to decrease quite sharply before the menstruation. But if so, the levels would be low, so you would think, oh, maybe it's the low levels that cause the attack. But I also mentioned that women after their menopause, they have less migraines, and at that time of their life, they also have low hormone levels. So it's not just low hormone levels. And what we think at the moment is that the decrease in hormone levels, that is steep, is causing the attack by an unbalance between the effects that happen at stable high levels or stable low levels. And some things are going on at that time in the body that we want to understand, but it's this change probably that causes the migraine attacks to happen just before or at the start of the period.
Yes, thank you. And with that, you will have 20 seconds extra for the next questions. You can use them. And so it's not the low levels, but the sharp decrease. What happens is with the decrease. Okay, okay. I think that's a nice way of putting it, and nice that people know this. And let's go to the next one. And in the Google, when they search when migraines, blah blah blah. Let's see.
When do migraines start age?
Let's select that. Yeah.
Yeah. So in fact, the question is, at which age do migraines start? And I think it's a relevant one, because what many people don't know is that children may also have migraines. And in the very first question, we already discussed that migraines are not the same as having a headache, but having a headache may be part of having migraine. And in fact, in small children, of course, at very low age, they can't express themselves very clearly. But what you see is that they often have kind of a headache or an ache in their stomach. And so they complain less about headache, but they do have complaints. And what we think is that this may be migraine, but then how it presents in young children. So it may be already after the age of 5 years, for example. But yeah, it relates nicely to the previous question when we were talking about the period. If you look in these young children, migraine is not very often occurring, only in some. And yeah, what we think is that even a little bit more in boys than in girls. And after the puberty, when the girls start menstruating, then we really see a sharp increase in the girls. So for many women, their migraine started when they were 12 to 18 years of age, so in their young years. And but it may already be in a child. And in fact, if people get older, and I can use a little bit of my extra time now, then it's less common that migraine still start. It may start after 40 years of age, but that is less common. So it starts in your early years. It may even start before puberty, but it may present in another way then.
Yes, I think that's also really like there are also subtleties with the age. So I think it's nice that you selected this one, and so because maybe people have an idea. Okay, it's younger age, not in the older age, but also when childs can also have it. That's was I think that was really important. And let's go to the last question from the Google. And now they ask migraine and blah, blah, blah.
Okay, we are in the middle of pandemic. Shall we choose the unavoidable migraine and COVID?
Yes, and I'm really curious myself, the relation between those. And the floor is yours.
Yeah. We don't know whether migraine and COVID are really related. We know that many COVID patients are suffering from headache when they have COVID, but that is not necessarily a migraine headache. So my answer would be very short, but of course there's more to tell about this. And yeah, one very recent development is that there has been a proposition in literature, because you know that during COVID and also some periods afterwards, often patients can't smell very well. And we didn't know why that was. And now there is a proposition in literature, so it has to be proven still, that maybe one of the important nerves of the brain that is playing an important role in migraine is also activated during COVID. And maybe the activation of that nerve causes the fact that people cannot smell very much. There are also other connections that we can think about. One of the drugs that is directed against a very small protein-like substance that plays a role in migraine, may also play a role in severe lung patients that are having COVID, and that drug may be helpful. And there's a clinical trial now going on to investigate that. And finally, we know that COVID can change some things in the inner lining of blood vessels, and that's also important in migraine. So in future we will look at a relationship. But that's it.
Yes, thank you very much. And let's see the overall. You answered 10 questions beautifully and used all the terms, which is okay. And even I think had 10 seconds left totally
so
when
I
answering
survived.
that. Yes, more than surviving. It was really nice. And for our first ever English speaking guest in this format, it was wonderful. Thank you for being here and answering in a simple way that the beginners of migraine topic can understand.
Thank you very much for the invitation, and also thank you very much for the initiative to get science to people with a wider background with your group of volunteers, which is great. So good luck.
Thank you. Any last words, anything you want to add before we close?
Yeah, to thank you, but I already did so. And maybe, yeah, a last word is that really lots and lots of people are suffering from migraine, and the World Health Organization has recognized this. It's really one of the most prominent disablers, but many patients think that they just have accept this, and it's belonging to their life, and maybe their mothers and aunts are also suffering, and they went sometimes to the doctor and it didn't help. There are now quite some novel options. So of course there's not a magic cure for everyone, but if you are really suffering from migraine and it impacts your life because it's really a nasty disorder, seek for help.
Yes, I think that's a really good message. Like, maybe they thought it was like in the past only a painkiller, and for some people it doesn't affect. But as you told in the question, like how is it treated? There are lots of and lots of new
Yeah.
options, and so there could be a drug that works for you, or even there are other treatments that I know, like Botox kind of way. I don't know if they are, scientifically sound, but
For a subgroup of patients, but also many patients get more chronic migraines because they take too many drugs, and it sounds very paradoxical because you are suffering from your headaches and you take a painkiller, and if you take too often, then it causes the pain. But it's very, very difficult to get out of this vicious cycle. So, yeah, really, if it affects your life, and they are family physicians, general practitioners, but also neurologists, but also specialized headache neurologists. So there are really platforms, and it's sometimes, some patients respond very quickly, but some patients are really resistant to headache, and lots of things need to be tried, but there are lots of options. And yeah, as a pharmacologist, I'm continuously working on providing even more and better options. But seek help. That would be my final words.
exactly, exactly. Thank you for coming, and for the
It's a
audience, thank
pleasure.
you. Thank you for
Okay.
watching, and see you soon in another episode. Bye bye.
Bye.